Hello, my name is Dr. Nadia Ali. Welcome back. For those of you who are joining us for the first time, please subscribe to continue being part of our healing community, where we share knowledge and research that we need to heal and sustain good health. I'm a functional physician and a mindfulness coach. My goal is to provide education and guidance to our patients and their families, as well as our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health by making simple, sustainable changes to our lifestyle. We can prevent and even reverse chronic disease. So let's get started. The topic that we will be talking about today is ADHD, and we will look at 5 ways we can overcome ADHD. So let's start by defining what is ADHD. So, ADHD or attention deficit hyperactivity disorder is a disorder of the brain, primarily as a brain is developing during our childhood. It is diagnosed in childhood, but it can continue into adulthood, and there are many people who get their diagnosis of ADHD later in life. It's characterized by a pattern of inattention, hyperactivity, and impulsivity that is more frequent and severe than is typical in individuals at a comparable level of development. So let's look at what are the symptoms of ADHD. So the inattention symptoms of ADHD refer to the challenges an individual might have in maintaining focus, paying attention to detail, and organizing tasks. So I'm going to be going ahead and defining some of these symptoms. So the first one is forgetfulness. So individuals with ADHD may forget to complete tasks, even those that are routine like chores or homework. They are disorganized, meaning that they have difficulty keeping things in order, which could include problems with keeping personal items in an organized manner, struggling to manage time and tasks efficiently, or having a messy work area. The third symptom is distractibility, which refers to trouble staying focused on a task at hand, especially if it is repetitive or tedious. These individuals can easily get sidetracked by unrelated thoughts or stimuli. Another important symptom is carelessness, which refers to making errors in tasks due to a lack of attention to detail. This might manifest in schoolwork or other tasks as making avoidable mistakes. Neglectfulness means that these individuals may often not seem to listen when spoken to directly, appearing as if their mind is elsewhere, even in the absence of any obvious distraction. Another symptom is non-compliance, which means that they may fail to follow through on instructions, start tasks, but quickly lose focus and get sidetracked. Procrastination is another characteristic. People with ADHD often avoid tasks that require sustained mental effort. They may delay or put off these tasks because they have difficulty starting or completing them. And last but not least is misplacing items. So they would often lose things necessary for tasks or activities such as school supplies, keys, wallets, cell phones, etc., and might spend a lot of time looking for these items. So now we will talk about what are the risk factors for ADHD. While the exact cause of ADHD isn't known, certain risk factors have been associated with the disorder. It is important to know that these factors can increase the likelihood of ADHD, but do not guarantee that a person will have these conditions. Here are some commonly identified risk factors. Number one is gender. So, males are generally more likely to be diagnosed with ADHD than females. However, um, a lot of times ADHD in females is often overlooked because their manifestation of ADHD is different than what we see in males. The second very important risk factor is prenatal exposure to drugs and alcohol. So, children exposed to alcohol, tobacco, and drugs while in the womb are at a higher risk of developing ADHD. Children who are premature at birth or have low birth weight are also at higher risk of developing ADHD. Similarly, children who have suffered a brain injury may show some behaviors similar to those of ADHD. However, only a small percentage of children with ADHD have suffered a traumatic brain injury. One of the very important risk factors for ADHD is early childhood trauma or stress. So, traumatic experiences, including physical or emotional abuse, neglect, or a serious accident or illness, can contribute to symptoms of ADHD. Now, we will look at what exactly is happening at the cellular level or the organ level when somebody actually has ADHD. One of the most important root causes of ADHD symptoms is inflammation of the brain. We know that a number of neurological and psychiatric conditions, including ADHD, has been linked to inflammation. The question is that what causes inflammation? And that will bring us to our next um, cause, which is nutritional deficiencies. So we know that certain nutrients, including omega-3 fatty acids, magnesium, zinc, and B vitamins, are essential for brain health and function, and these have been linked to ADHD symptoms. In addition, we also know that some of these nutrients are very important in terms of reducing inflammation, and hence deficiency of these nutrients make it difficult for the body to be able to reduce inflammation. The third very important reason for the development of ADHD at the cellular level is imbalance of neurotransmitters. Neurotransmitters are the brain's chemical messengers which play a crucial role on mood, focus, and other cognitive functions. If there is imbalances in neurotransmitters such as dopamine, norepinephrine, then these individuals will have difficulty focusing. And there are a number of reasons and factors which could lead to neurotransmitter imbalances. One of the most important factors which contributes to neurotransmitter imbalances is leaky gut, also known as intestinal permeability. When someone has leaky gut, they are at higher risk of developing inflammation. These individuals may actually have undigested food particles and other substances that enter the bloodstream and trigger an immune response and inflammation. These individuals will also have nutritional deficiencies leading to higher risk of ADHD. And very importantly, a number of neurotransmitters or chemical messengers are actually produced in the digestive tract. And so, having a leaky gut means that there will be neurotransmitter imbalances. Last but not least, a very important factor which is responsible for causing inflammation is environmental exposure to toxins, such as metallic toxins, including lead, and non metallic toxins, such as pesticides, as well as endocrine disrupting chemicals, which we now know have been linked to ADHD. These toxins interfere with brain development and function and contribute to inflammation and oxidative stress. This is one of the reasons why we are seeing the prevalence of ADHD rising. So, now we will be talking about how common is ADHD in the United States. We know that in 2021, ADHD was diagnosed in about 1 in 10 children aged 2 to 17 years in the US. and for adults, the prevalence is 1 in 23. So now we will look at functional medicine testing for treating an ADHD child or adult. So one of the most important role of functional medicine is to be able to do comprehensive testing. The comprehensive testing is very important to identify what is happening at the cellular level. For example, we will be looking at nutritional deficiencies. We will be looking at what's going on with leaky gut. We will also be looking at food sensitivity testing because if there are certain foods which are affecting the system and causing inflammation, then that would help us come up with a nutritional plan which is customized to that individual. We also do gut health assessments, and gut health assessments are crucial because they help us identify if there is an underlying leaky gut or not, and whether there are actually bacteria or fungus in the gut which are causing inflammation. We also do genetic testings such as MTHFR or methylation gene, which affects metabolism of the vitamins in our body, as well as ApoE gene, which increases the possibility of developing dementia in the long run. The other type of testing we do is heavy metal testing. Heavy metal testing is very important because it helps us look at whether we have been exposed to heavy metals such as lead and mercury. We also do hormonal testing because we do know that there are a lot of hormone receptors in the brain, including thyroid receptors, as well as cortisol receptors. And we know that an imbalance of hormones can directly cause inflammation of the brain or malfunctioning of the brain. We also do toxin testing. Toxin testing is extremely important. It includes toxins such as mold toxins. It also includes looking for pesticides and other chemicals that a child or an adult may have been exposed to, and those are actually affecting the brain's function of these individuals. So now we will be talking about 5 ways we can actually overcome ADHD. One of the most important tools that we have found to be very useful in our practice is microcurrent neurofeedback. Microcurrent neurofeedback is a non invasive approach that we use to regulate the function of the brain and make it work more efficiently. The way it works is that we apply a very small amount of current to different parts of the brain. It's called microcurrent. The current is so small that the individual is actually sitting and reading a book or playing games. But while they're doing that, the current is basically allowing the brain to create new pathways, more efficient pathways. And so this method has been shown to improve focus, attention, as well as behavioral issues related to ADHD. Second very important intervention that we use is intravenous nutrition. Now we know that a lot of those individuals who have ADHD have nutritional deficiencies and they also have gut issues. And so intravenous nutrition is one way to make sure that we provide the required nutrition to the brain to allow it to function in a more efficient and effective manner. The next thing is to have a customized nutritional plan, and this is one of the most important interventions because everyone's nutritional needs are unique. And a diet that works well for one person might not work as well for another. A customized nutritional plan for a person with ADHD will depend on the root cause of the ADHD. So we will be looking at the data we have collected through the testing to let them know what exactly do we need to have in their diet and what exactly do we need to eliminate. Gut healing, as we have discussed before, that the gut and brain are very much connected. And we know that this connection, if healed, will have a significant impact on brain function. We know that disruption in the gut microbiome or the bacteria in the gut, if imbalanced, which is what we call dysbiosis, can influence the brain function and behavior. Hence, gut healing is one of the most important strategies that we use and can be used to address ADHD. And last but not least, detoxification. As we have said before, that toxins play a very important role in causing inflammation in the brain. And so the process of detoxification involves identifying the toxins and then making sure that we get rid of those toxins for optimal functioning of the brain. Thank you so much for being with us, and we look forward to connecting with you next week. Take care. Bye bye.